move into doing this, I will give an overview of the key lessons that we have from adaptation. But before we progress, I would like just to invite Dr. Atela to just give a few remarks, after which I will then move on to give a presentation on some of the lessons that we have learned from the adaptation component.
So mine is also to extend a welcome note to this end of the year 2021 ARIN conference, which is basically focusing on evidence. And I would like just to quickly, read a small speech that we've put together. One of the other things to mention is that we have speeches that will come from the Kenyan Ministry for Environment, but also from our other speakers. And these speeches will perhaps be read as we go along the conference. But in the interest of time, I'll just proceed to quickly read the speech that I have, just to contextualize why we are doing this. So as the world reconfigures its efforts towards addressing the changing nature of global challenges such as health related challenges, climate change, and others, sustainable recovery from these challenges have become a major agenda. In many developing contexts, such as Africa, efforts to recover from these global interactable challenges have been marred with significant rush to return to economic normalcy, leading to increased risk accumulation, greenhouse gas emissions, health hazards, disaster risks, among others. So African countries are currently re-engaging the world in green recovery dialogues, climate change discussions, but also disaster risk issues. And we just came from Glasgow, where there was a lot of passion and pursuit about Africa's leadership in climate change to inform policy and action. These have not been properly consolidated to be able to kind of inform a more consolidated or collective positioning for Africa as a continent, and to be able to show really where are the gaps and where do we need to intervene. And most importantly, how do we create an agenda which is more demand-driven when it comes to research and the use of evidence to support some of this, or to respond to some of these challenges that we are talking about. So the ARIN 2021 International Reflective Conference, deemed evidence-driven sustainable recovery from global intractable challenges, builds on a synthesis and insights from the convenings that basically we've highlighted. And these convenings were undertaken within three key challenges that Africa is actually facing. One of the challenges is health. Of course, we are talking about COVID-19 at the moment. The other challenge is climate change, which of course reports, the latest IPCC report, and of course the past ones have actually put Africa as one of the most vulnerable continents or places in the continent. And this is not new, really, because this has been the story for a while. And of course, that report is also very critical in terms of some of the research gaps, looking at issues to do with adaptation and the needs to strengthen what is it that can work for vulnerable communities. So these are calls which are not just happening at this particular time, but they are calls which have been in place historically. Yet actions to be able to consolidate and try to bring this into a more consolidated next steps has or have been lacking in the continent. And this is why ARIN is basically trying to create a foundation, create a space where we can have dialogue, where we can try to begin these discussions and see what is it that different people, different capabilities have to be able to support a more collective approach, not just a collective approach, but a synergistic way of addressing these challenges that are presently affecting the continent, but more broadly are going to affect the continent in the future. So as I've mentioned, the conference is basically a foundational dialogue towards how to strengthen evidence response, evidence-driven response to some of these global challenges. The conference is scheduled to start from today, which is 25th of November, 2021, and will run through to the 29th. So today we will have some of the highlights of some of the things that have been done, some of the key insights that have emerged from our convenings. Tomorrow we'll begin to explore, what are some of the partnerships to, or what are some of the options to be able to address some of these particular gaps in a more strategic way. And finally, just to highlight, and as I've said, the ARIN network is basically working with a number of partners with the aim and the passion to be able to, bring things together, bring expertise together, bring lessons together, bring learnings, together, and be able to harness, the strength and the rich, innovative ecosystem that Africa already has in terms of many things, in terms of skills, in terms of resources, in terms of the policy environment, and also in terms of international partners and support. So just briefly about the ARIN network. ARIN network is a network of over 200 researchers and policymakers across 36 African countries. And the network is aimed at promoting research excellence and dialogue on best research and impact practices. The network provides one of the unique convening platforms for science policy interface in Africa, building on evidence. It recognizes that Africa is a home to multiple researchers, innovations, and best policy practices, but these remain poorly shared, learned from, or used to inform impactful research and development agenda. The ARIN therefore provides a peer review platform where best research and impact practices from different African contexts are shared, profiled, and leveraged to inform a transformative policy agenda. Ladies and gentlemen, I know these are not normal times, as I've said. The pandemic is still here with us, and we have been confined in discussions, dialogues, webinar after webinar, all geared towards trying to discuss efforts to bring thoughts together. But I do hope that this particular reflective conference will be useful to you and will be a good Christmas gift as we think about a more transformative 2022. So let me take this opportunity to thank you very much for making time to be part of this journey. And I hope that you are going to enjoy the process. I thank you very much.
Okay, thank you so much. So I will be speaking on adaptation research and policy progress in Africa, so that we can draw and see a couple of insights from the work of ARIN. As a way of introduction, I think it is important just to note that the climate change impacts are projected to increase in Africa, and this is actually not new. Report after report on projections show that the impacts will actually be more. Why? Because obviously of the low adaptive capacity that a number of African countries have, the high sensitivity to climate change in a continent where the majority of people depend on natural resources-based livelihood strategies, which are very sensitive to climate extremes, and then the high vulnerability. Now, within this context, you realize that with the low adaptive capacity, high sensitivity, and high vulnerability, the kicking in of the COVID-19 has actually worsened the situation. So adaptation was now examined in Eastern, Southern, and Western Africa, just to see lessons that we can learn on how we ought to respond to this. Now, in terms of the methodology that was used, we had all these convenings with over 3,000 people participating in over 30 convenings. Now, what are some of the key insights that we get on adaptation from the Southern and Western Africa? So what we did was that we had a convening for East Africa and then the Southern and Western Africa. I must be quick to mention that we did not have a convening for North Africa, but this is something that we need to look at as we move forward. Now, one of the key things that came out is that there is an increasing push for contextualized adaptation research, planning, action, and finance in addressing the impacts of climate change. So the policymakers, the practitioners, one of the things that they are saying is that we need to actually contextualize adaptation research planning so that this responds to various challenges within specific contexts. The other thing that also came out prominently was that there's need for transformative adaptation research, and this transformative adaptation research needs to look at shifting of power relations. It also needs to look at knowledge structures and learning systems. Now, these are important so as to accelerate the impact for the most vulnerable communities. Now, the need for this transformative adaptation research is simply because embedded within the vulnerability, embedded within the sensitivity of people to climate change are power relations, which often are neglected in strategies that are developed to reduce our vulnerability. So there is need for transformative research that addresses power relations, the knowledge structures, as well as the learning systems. Further, there is also need for multi-level partnerships for transformative adaptation research. Now, these are needed to steer forward adaptation as the highest priority. Now, within Africa, adaptation obviously is very critical. And as we look at adaptation and mitigation, we tend to lean more towards adaptation. Now, for us to adapt to climate change, there's need for these multi-level partnerships that will help us steer this forward. Then the other thing that came out is that there's need for the generation of robust evidence on best adaptation practices for Southern and Western African region. Now, what this simply means is that there's need for robust evidence so that adaptation is actually based on evidence. Dr. Atela did allude to this in his introductory remarks that there are a couple of times when adaptation actions are just lifted from one area to another. But we need to ensure that we have robust evidence so that our adaptation is based on evidence. Now, when you look at this evidence, it's not at the regional level. We need evidence at national level and even at subnational levels. Now, this is actually a prerogative of stakeholders who are within the region, simply because they are the ones that understand the various challenges that they face and therefore need to be key in finding solutions to those challenges. Going now to the convening that we had in East Africa, what are some of the key insights that came out? One of the things that came out is the fact that there's need to establish a regionally led adaptation learning framework that could fast track the realization of evidence-based learning. So there is need to have this regional important framework that will help us fast track realization of this evidence-based learning. There is also need to develop robust regional data management for better access and utilization by climate change stakeholders. So we need to have a database. One of the challenges that you'll find not only in East Africa, this is also the case for Southern Africa, is that we seem not to have a good database at national level, even at sub-national levels. Now, a good database is important because it is actually the starting point for good adaptation measures that can be developed. There is need for a regionally led adaptation tracking and indicator framework, which then will capture the impacts and lessons. So that, because these are needed to facilitate appropriate climate finance and technology deployment. So we need to actually have indicators and then be in a position to actually track these indicators. The other thing also that came out prominently is the need for community adaptation innovations. Now, these have actually emerged in the region, including nature-based solutions. So we need to actually look at this community adaptation innovation so that we can build on that. Now, if you look at this point, this actually strengthens the fact that good adaptation should be done by stakeholders within specific regions. Researchers, policymakers, and climate change stakeholders need to actually strengthen this locally led community adaptation innovations systems that not only will scale up, but also leverage innovation platform from other regions. So what you're saying is that apart from these community-based adaptation innovations, these must be informed or supported by researchers, policymakers, and other stakeholders so that this is actually strengthened. In East Africa, the linkages between science and policy are still not yet robust, and there's actually a need for this to be strengthened. So this came out very strongly among the various stakeholders, and it was good that in our convenings, we had policymakers, we had researchers, and people coming from different backgrounds. So this came out very strongly. The delegates therefore called for the adoption of innovative research options, and these innovative research options should include the use of space technology to maybe map and analyze complex ecosystems. For example, if you look at an ecosystem like Victoria, which is quite complex, looking at various systems, not only like Victoria, but we also have a couple of others within the Southern African region that will require a complex approach. So there's need for technology that will use this space, and then this will be critical to support transformative solutions. Now, in terms of my conclusion, looking at the engagements that we had in Southern Africa and West Africa, as well as the engagement in East Africa, what are some of the key lessons? One of the things that is coming out very strongly is the need for adaptation learning framework, to have an adaptation learning framework, and this framework needs to actually have even indicators developed. Now, once this is done, then this will be helpful in tracking progress. In the absence of a framework, this will be a bit of a challenge. It will actually be a very big challenge. The other thing that also came out is that there's actually increasing recognition of nature-based solution and or ecosystem-based adaptation. This is actually growing in recognition. And again, this needs to actually have good indicators developed so that we can have this learning framework under which we can understand it. There's also the need for more investment in research focus on interactions between like the new and old land use systems, and also appreciating their roles in adaptation in the face of this unprecedented climate variability and change in the region. So it is therefore clear from our engagement with various stakeholders that there is a need to actually, there's need to adapt, but for us to have meaningful adaptation to the various risks that surround us, there is need to actually develop appropriate adaptation measures, and this must be done within a good framework with indicators developed, and this must also bring to the fore community-led innovation. With that, I'll end my presentation, and thank you so much.
I'm going to take you through what we did around evidence-driven response for COVID-19 in Africa. So this work was to come up with rapid response in different areas that I'm going to talk about, really to try and create that science policy interface. And I see a couple of colleagues that we did this work together here. Pleasure to have you here. So this was a broader program or project by the African Academy of Sciences through its various initiatives. And of course, ARIN led more of the science policy engagement work in a number of priority areas. So we relied on the Cochrane methodology around rapid reviews, co-constructing questions with different stakeholders, and through these then trying to find out what evidence exists and packaging of this evidence for policymakers. So I'll just share broadly high-level lessons that we took from this particular work. So in terms of what we did, So this was mainly evidence review for the COVID-19 outbreak that is still with us. So a lot of it was to do with discussions with various policy makers, stakeholders, drawn from a broad spectrum of expertise. So we had epidemiologists, global health experts, mental health experts, academia, and of course, the wider community as we sent out invitations to all these groups. And one of the things that we did was to carry out series of teleconvenings virtually. And this was really to co-develop the research questions, frame the problem so that it suits the different needs and the policymakers. And then we did a lot of rapid evidence synthesis based on the prioritization of each particular research topic. And of course, the evidence was geared to improve the continental and national preparedness and response. And then thereafter, we did a production of policy briefs. So we had about 7 areas. One was around transmission, epidemiology and surveillance, diagnostics. Some of it had to do with how you characterize clinical cases and mental health. We also had one on drugs and vaccines or clinical trials. We looked at broadly impact of COVID-19 generally on health systems. And of course, social science and policy research. And one of the things that we did was to look at how vaccine uptake, or what you call vaccine hesitancy, plays out in the continent. So, so I'll just take you through in terms of how we obtain this evidence and why these key areas, because they were quite interrelated and they were quite significant, for African countries to build a very synergistic approach in terms of building back or building better from the pandemic. So when it comes to transmission dynamics and epidemiology, one of the key sources of evidence was around the models that have been used to track and, of course, guide the response of COVID-19. And we saw a number of models have actually been used both directly and indirectly. Some of them guided how decisions were being made. And then in terms of diagnostics, we looked at what are the testing approaches or more of surveillance ways that have been used, which test approaches were quite significant, which ones were underdeveloped. So these were sources of evidence around models and methods around how COVID was tested. And of course, some of these methods, whether self-reporting, antigen testing, some of these methods actually informed, the recovery rates, advisory measures to be put for the emergency. Then when it comes to how cases, clinical, characterizations and how cases were identified, scanned, so a lot of evidence came from existing frameworks, and more particularly how research has been done on the continent. You are aware that we had, previous diseases like Ebola, and a lot of evidence came from, those existing frameworks around how clinical cases, characterized the comorbidity issues, how you deal with, mental issues. So a lot of it came from, the existing frameworks and the research that was being done around what is currently ongoing. For example, if you look at mental health and how this community, self-organized community mental, I could call them experts, supported, recovery or response to people who are challenged mentally. And then when it comes to clinical trials, a lot of evidence came from the committees that were constituted. So we saw a number of committees in the continent or in different African countries that were constituted in order to support or fast track how vaccines are perhaps regulated. We saw expert committees constituted to do a number of pharmacological or pharmacological vigilance systems. And then the other topic that we did was to look at impact, of COVID-19 generally on health systems, and a lot of literature or evidence came from published literature. We relied on evidence from broad databases. We could call them global COVID-19 case information. So we had,
we had
other international bodies like CDC, WHO. And a lot of evidence was around how we could have accurate, precise modeling systems for the health system, so that there's better public health planning and intervention strategies. Of course, when it comes to social sciences and policy research, again, evidence came from learnings from previous pandemics, and a number of it around stakeholder participation. And then when it comes to vaccine hesitancy, where did the evidence come from? So a lot of evidence was on, self-evidence through social media, because this is where we are seeing misinformation or information being provided. And all these, plenty of information circulated. And so another evidence also was more anecdotal evidence from healthcare workers. So broadly, these were the sources of evidence in this broad spectrum of areas. So what did we learn about the key enablers and disablers of evidence? One of it is that politics is an enabler of this evidence, more particularly expert committees. But again, it could be a disabler of evidence, because of personal considerations, driving evidence so that decisions are made. The other key enabler we thought really enable evidence use, evidence emerging is different models of how evidence is obtained. So we had a lot of these expert models relying from WHO and other experts. Based on that, some decisions were made, because this is quote unquote experts. And then we also saw not so much participation around citizen science, where the citizens inform the evidence. So what we are saying is that in different areas, there was a pluralistic model where you have the expert, the citizens coming together to generate evidence. So this was a key enabler, because where such occurred, then you had uptake. And then the other thing is around informal rules and practices, things that are actually just made political pronunciations. And these are quite informal in their nature, but in one way or the other, they enabled evidence uptake and use. Then we had another enabler, which is about external influences in policy direction. So these experts advising how countries should either talk about lockdowns or vaccines. So these external influences have been an enabler for policy uptake. And then the other is about multi-sectoral and collaborations across science and policy. So bringing all experts and having everyone sit at the table, this is one enabler of evidence use. And of course, mobilization across generations. And by this, I mean the young, old, middle. So this was another enabler of evidence really to bring about health and social systems reform. So lastly, I just want to go through the lessons learned. How do we move forward when we want to improve evidence, not just for COVID-19, but even for disaster, other emergencies to come or other challenges? One, from the model and from our learnings from COVID, is really to create that demand for evidence. Because when we went through needs assessment, prioritization, we have learned that uptake of the way evidence is used is more about the demand. So if we can create more demand for evidence through one or two ways, I think we are able to improve how evidence is taken up or even used. The other one is about consultations with the users of the evidence, but again, with the people you are creating this evidence for. And these are the communities, the poor, the rural, etc. And then we need to be very deliberate on how we frame the evidence, because once we realized with COVID-19, evidence was needed in specific areas, in specific context. So we need to be very deliberate how we frame this particular evidence. Then the framing really determines how that evidence will be taken up and used by policymakers. Then the other is about knowledge translation and practice. And when it comes to knowledge translation, it's about how do we relay and convey this messaging once we've done a rapid synthesis from complex to simple, granular information that can be taken up. So we need to strengthen how we translate the knowledge and even at the practice level. The other issue is about timeliness. So for COVID-19, really, it was about, I could say, rapid, quick evidence needed. And we saw evidence generated, perhaps not tested, but that evidence was quite timely for uptake. So this is one of the ways we can improve. And then lastly, what we realized is really a lot of creating a science policy that is really pro-poor or focused on people who are not included. And one example I can give this is in Malawi, where we saw lockdowns being implemented without consultation or without thinking about the poor, and there are court cases because of this. So when we are generating evidence for use, we need to see how it interfaces with the poor or pro-poor, neglected, and bring that element of inclusion. So I think that's all. This has just provided a high level information on what we did, but there's a lot of material and information that can be found on the link, and it would be great if this can be posted on the chat. Thank you very much.
Thank you, Felix. Thank you, delegates present. And let me go directly to share this experience from Nairobi. So my name is Charles Planui. I'm a research fellow at the African Center for Technology Studies, also supporting Nairobi Risk Hub as a disaster risk policy analyst at the regional level. I'm also contributing as engagement and policy organizer for ARIN. So this particular study started in 2019 and is funded by UKRI, Global Challenge Research Fund, and the impact partner is Nairobi City County Government. So under the Nairobi Risk Hub, we have got different partners, both from the UK and those based in Nairobi. But the most important thing is the study is focusing on using the multi-hazard risk approach to understand the risk and the cascading risks and their impacts in Nairobi and their policy implications. So the focus for those who are new to the study. We are focusing on Nairobi City, but also we did select 2 informal settlements. So one is called Mukuru and another one is called Kibera. So Nairobi has 11 informal settlements. So the aim actually, especially for Mukuru, is to understand the consequences of development interventions on dynamic vulnerabilities to hazard risk and decision support environment for risk integration into integrated development planning in Nairobi. But also the lessons from Mukuru is to inform also the planning for Kibera, because Mukuru is the first informal settlement in Nairobi to develop what you call a special area plan, and the others 4, including Kibera, have been gazetted. So in the approach that we have actually used, we have used city-led DRR policy dialogues. Last year, we held 3, and we had also key informant interviews, especially targeting the different stakeholders. And we also brought in the local community. So we did map 150 community-based organizations across the informal settlements in Nairobi, and we brought 30 for a dialogue. And recently, we did also a comprehensive survey to look at the implication of the infrastructure on risk reduction in Mukuru, and we did select Mukuru Kwarubed, which is a small segment of one of the informal settlements, and we had 400 households. So we have also documentation and all, looking at also flood hazard modeling, which is ongoing. And the question now is, what are some of the key lessons that could inform integrated urban planning? So what are some of the key policy lessons or general lessons? So we have got 4. One is that building relations between governments and stakeholders is actually a key enabler to facilitating not only learning, but also uptake of evidence to inform policy and planning, both at the city level and at the local level. And for the hub in 2019 May, there was a signing of MOU between the county government led by former governor of Nairobi and also the team from the UK and Nairobi. And thereafter, we did engage, especially the sectors across the city, and we brought together 12 sectors, which actually submitted their standard operating procedures for review. But also we did map the DRR stakeholders across Nairobi. And one of the output is that the humanitarian agencies actually are, if you look at this infographic, you realize that the humanitarian agencies make the larger part of the community on DRR, but the private sector in red is actually quite small. So there is need especially to enhance a stakeholder contribution. But also, what is the vision for Nairobi? So one workshop was convened to bring together the stakeholders from Nairobi to share what could be the vision for Nairobi. And largely, they agreed that for a better, high resilient Nairobi, there must be strong contribution from private sector, but also support from the county government as a regulatory agency. A second lesson is multi-hazard risk assessment is key in understanding not only risk, but also cascading risk and their impacts among the urban poor. And this we have done flood and fire hazard modeling. And if you look at the incidences, especially in Nairobi, is quite increasing, but of course, some are not drastically increasing. And when you look at this other map on the right, the red is showing where the flood impact actually is expected to be very high. And this is where the informal settlement like Mukuru is lying. In terms of fire, the buildings are actually quite close. So there's high potential, if you look at the red, high potential for fire spread among the infrastructure. So another second lesson is that integrated policy approach is critical for building resilience of the urban poor, especially, and also developing cities. And one, we did what you call policy mapping, where we realized at the global level and the national level, there is quite substantive policy development. But when you look at the below this dark line, this is what is happening in Nairobi City. So there is limited policy work which is ongoing. But of course, the city managed to develop the legislation in 2015, but it doesn't have a policy a plan and a strategy to operationalize. And one of the output of this is that the cities sectors, that is the high level policymakers, and then also the middle level, that they couldn't operationalize the legislation. When you look at the sector level also, which we did, look at the standard operating procedures, why means these sectors add the standard operating procedures, ND meaning that hazard or risk was not detected. And you realize that largely all the sectors didn't integrate risk into their standard operating procedures. The second lesson is the risk landscape is quite complex. And if you look at this analysis of stakeholders, you realize that at the subnational level is quite complex. Now you find that each player is trying to do something, but there's no lack of clarity in terms of responsibility, and also especially bringing on board strongly the private sector. The last lesson is that developing a city-led DRR research and impact forum framework is quite critical in supporting leveraging the lessons from the research to DRR platforms. And this is the entry point for the research, especially the multi-asset study that you are undertaking, is actually at the prevention phase, where it should now feed at the subnational level, fitted with the government-led and UNDR-led platforms. So this is the overall framework that you have co-developed that could support us to engage now in terms of what you have done here, from stakeholder mapping, risk modeling, policy mapping, community engagement, and stakeholder engagement. How can now this transition to the DRR platforms where the policies are being decided? So this is the framework that you have developed that just a feedback mechanism, but of course we are still improving with the partners. So how do we fill the gaps, especially the low capacity, the lack of risk integration, is that you have the plan with the city to improve on the lessons learned from the risk vulnerability assessment, modeling, but also organize for targeted city-led DRR workshops, which are starting next month and also ending in April. First is to co-develop a DRR database for Nairobi, provide policy oversight, especially updating the 12 sectors standard operating procedures and the legislation, and also strengthening the citywide community of practice, but also linking with the DRR platforms, and of course sharing the lessons with the regional and global DRR platforms. So what are the implications, especially of the decisions that are going to be made? One is actually to inform the evidence-based DRR policy framework and risk-proof planning to facilitate resilient Nairobi. And also secondly, the output of the 8 regional platform for DRR in Kenya, the declaration which was made at the 7th high-level meeting add some of the provisions which can give us the opportunity, because it acknowledges the sustained and regional partnership, but also the area around advocacy and integration of evidence. So this is going to be our target in terms of bringing also the stakeholders, and you have engaged. And I think the team from BNDRR is actually present, and they've been involving us, but not only bringing the wider DRR stakeholders, but also especially the private sector. And I think leveraging also making resilient cities 2030 to be one of the items that you are going to utilize this platform to leverage. And of course, lastly, is to sustain evidence-based learning among the DRR towards achieving this high resilient Nairobi of tomorrow. Thank you so much.
Thanks, Felix, and thanks everybody for joining this session. I'm just adding into some of the ideas that have already been shared across the different sectors in climate change, health, but also in adaptation on one side and urban development on the other. So as part of this year's reflections about how we address evidence that is needed in Africa, we also explored the aspect of decoloniality, especially as it resonates with methods. So this whole work was, we worked with a lot of partners, but more importantly, it was anchored towards delivering an idea, but that within ARIN, we are focusing on decolonizing methods for sustainability research.
So I'm presenting this, but it's a lot of work in the background that has gone into this year's work around decoloniality from the team at ARIN, the team at STEP Center, the team at Umbela in Mexico, all guiding towards these lessons that we're going to share. So ideally, the whole topic around decolonizing methods for sustainability research needed us to have a reflection in the sense of, are we able to really use methods to change anything? Is there agency for the people who are doing research and using different methods? Here you're seeing a picture of young people who are really passionate about pursuing the idea around decoloniality and using it in research as part of the summer school we had. So in that line, then what did we do? First, we had contextualizing seminars. One of the three of them throughout the year. The first one was basically in understanding and defining what we mean in general by decoloniality. And then we went ahead and started, looking at, now that we understood decoloniality, how does it impact us as we do research, as we are able to enhance our capability. And then later on, we started reflecting on how then do we disrupt, based on the context, how do we disrupt the methodological paradigm in Africa. Continue the conversation, we also had webinar series, 8 of them throughout the year, with local partners, international partners, and all these series have been documented. On the website, you'll see the blogs, you'll see some of the reflection pieces about them. But these webinar series were basically to start having conversations between policymakers, among policymakers, and researchers and practitioners and all that. And we had very passionate conversations throughout the year about methods and sustainability and transforming us towards sustainability. In the end, we had the summer school, which was at the top of what we did, because the summer school is now packaging all that we have learned. How can we pass this knowledge on to the next generation, to the next group of decoloniality advocates, and therefore researchers and policymakers who are pushing for decoloniality agenda in the continent. So we did look at 5 key topics throughout the year that was anchored around decoloniality. We looked at how valuing diversity, and this is the conversation you normally have about, control and care and conviviality. When you think about diversity and valuing it, there are people who want to control the narrative, there are people who care so much about the narrative. But the idea is to balance between control and care to allow for that context to emerge. And that's where conviviality comes in. We also had a conversation about challenging power through methods. The whole idea of scholarly activism. How do we really enhance the agency of researchers to actually make a difference when it comes to the concept of, you're doing research for what purpose? Are you able to use the research and the privilege and the power that you have as a researcher to be able to influence action? And that's the conversation we had around that. And then we also had a reflective discussion about philosophical underpinnings as one of the topical areas, because we were started realizing that we come from very different backgrounds, different disciplines, and when researchers and policymakers convene, often the question is, I've been taught this way, you have been taught the other. The ontology behind how you practice research or you practice engagement with research to sustainability is often advised by, how you've been trained and how you have emerged as a leader in knowledge and the privilege you've gained. Talking about all those things requires that we understand the philosophical underpinnings under which the methods that you practice are embedded. And that's one of the topical areas we talked about. We also talked about multidimensionality, considering that when you look at methods, then you have to start thinking about the different dimensions that come into play. Are these dimensions able to enable or disable the success of how we use methods to challenge sustainability research? And then the last topical issue that we also explored around our context seminars, webinar series, and therefore the summer school was about how do we articulate research methods? How do we not just copy and paste methods, but how do we contextualize in the customization that we make for research methods and create a difference in terms of the methodological application that we bring on board? So all this said, we are doing the book, and I think we'll talk a little bit more tomorrow about the book. So I encourage everybody who's here to join tomorrow for us to discuss this book that is packaging some of the lessons that we've learned in terms of the scholarly bit of it in decolonizing methods in transformation to sustainability. What are the practices? What are the theoretical underpinnings? What are the practical implications? Where are the case studies? This is what all the book is about. So all this we did this year. And from this, we had basically 2 lesson areas. The first lesson area was about understanding what can enable or disable the whole idea of decolonizing aspects. We came up with basically 2 nexus of looking at enablers and disablers. One is about coloniality and the other is about self-reflexivity. Often it's seen as if for you to move ahead, you have to be part of the few. And here we have this particular picture on the left bottom of the screen where you're seeing someone, into the future saying that before the great subscription crash of 2017, scientists believe that the more inaccessible a study was, the greater the impact of that particular study. Meaning there's a lot of control towards for you to be at the top, then you have to really seize control. You have to be dominant. The incumbent power has to be absolute. And that is the center of colonial dominance that we want to disrupt. And that has been one of the things that makes it very difficult for us to think about sustainability research and decolonizing at it. Then there's the other side of the story where we are seeing power shifting from the few who are able to say have high impact papers and all that, to the many where power is shifting to several stakeholders, but then that power is also contextual. And you see a picture on the top right side of the screen that looks at how we are taught about things in school. But then it's actually a mess in life, that geometry interacts with chemistry, with biology, with art in different perspectives. Literature comes in and disrupts all of it. So looking at it in that sense, you start realizing an important fact, and that is about the self. The self in the sense that for us to be able to decolonize, we need to start from our own reflexive perspective. We need to reflect on ourselves, and therefore decolonized with reflexibility allows us to be able to move forward as an enabler area. So it's not just about the system and the institution, it's also about the self. Now, the other area of learning that we also had was about looking at some of the gaps that are perpetuating the whole coloniality to continue going. And one of them is research funding. There's already been mention of how do we bring contextual funding, but then how do we also make research funding in the context that we need it. The other perspective is about power dynamics when it comes to research, because we have people who are advanced, people who are junior, and all these dynamics have a way of reinforcing the gaps that we are seeing. The other perspective is multidisciplinarity that is not really multidisciplinarity. So it's pseudo-masculinity, and what that means is that the transformation that is embedded into multidisciplinarity doesn't come to pass. And then the other one is about gender issues and final research politics. Now, sorry?
You can summarize.
Okay, perfect. Yeah, so we started thinking, how do we then disrupt these things that are reinforcing what you are seeing in terms of coloniality? Is first we need to disrupt the funding flows so that we're able to have we set agenda as people who are able to do the research or impacted by the research. In terms of research power dynamics, we need to be able to think about breaking the elitist view of research so that we transfer power to the people who are impacted by the research, or people who are part of what we call the researchy community. We also looked at these disciplinary issues. We need to have applied capacity, build agency that can allow us to have true multidisciplinarity when it comes to research. And when it comes about gender is not just about male-female, but one of the key areas that we looked at is in terms of discipline balance, because disciplines balance allows us to think about both male and female, but also other gender groups that can come into play. And finally, under research politics, there's always this north-south thing. And the other thing is that the dichotomy of north-south in itself also was challenged, because when you have this north-south, then you're really reinforcing this politics of knowledge. So then we need to think about how to build the agency of researchers versus the researchee in the context of disrupting the research politics. All this then led to sort of an implication that we do need to decolonize knowledge and learning systems. And I'm making this caveat in terms of the global south, because it is the global south that has to start from and not anywhere else. So based on that, we did discuss a few things that can add to this space of decolonizing knowledge and learning systems. And this was one of the areas that when we packaged everything, we realized that in the end, we need to have some research fund. We need to have some scholarships that are really focused on decoloniality embedded scholarship issues. Transdisciplinary dialogues, an important factor. We stopped having dialogues that are based on single silo effects. And then also redefining how we look at methods, how we define the whole concept around methods of research and all that. So redefining ourselves in that, and this brings the whole idea of reflexive perspectives. And finally, we had to start moving towards decoloniality pathways. And this is the agenda we are setting forward into the next year to start looking at what are the decoloniality pathways that we can adopt and push as a network. And with that, thank you very much from ARIN.
Chair, and thank you, presenters. I think those were really very provoking and insightful highlights from our conversation.
Thanks, Jonas. I can provide a couple of minutes of reflection. First of all, really thank you very much for those 3 presentations, which were really exciting to see. And I hadn't anticipated quite how clearly the talks were going to address the tensions between knowledge production and power. So I think you're all really putting your finger on the most important topic of our time. I mean, yes, that talks to, in particular, I suppose, the challenge of the complex policy and practice and science space that this workshop identifies. If we're in a world that is moving increasingly towards claims of there being virtues around integration and holism and systems thinking, so the connection between health, perhaps COVID and others, climate change, development. I mean, that is analytically satisfying, but for decision makers, it can be a reason to lead to stasis, procrastination. This thing is so complicated. How do we move forward? So the focus on science and power is super helpful. I thought I was reflecting a little bit on the arc that science has made and trying to place the projects within that. So I guess we can say that science has gone on an arc from prioritizing the description of a challenge towards the co-production of responses, and maybe entering a phase where we're problematizing the evaluation of those responses. And it felt as though the presentations were in that co-production of responses space. So if there's time for discussion, it would be interesting to see how far, and perhaps Nora's work has touched on this, you've been able to open co-productive space around the evaluation of responses. And behind that is the recognition, of course, that there are many responses to a challenge, many of which are invisible to perhaps the sorts of actors that have more power and may be more accessible or prioritized by research, setting up the sorts of problems that Joe outlined. Certainly, I guess one sees, and I'm sure there are more, but at least 2 strategic opportunities for science in this mix of knowledge production and power. And again, it would be really fascinating to see if there are any reflections, if we have time. First of all, that science has the ability to, well, or it's a question, does science have the ability to enhance transparency in discussions between different decision makers? That could be across gender, or it could be more vertically between city and community groups. Can science be a language? And the methodologies behind science bring a certain rigor that allows politics and private interest to be put to a side. And so a more egalitarian, less colonized, in the language of Joe, set of outcomes. I think we're quite a long way from using science in that way. Science, in the way that Joe presents, I would agree, tends to think of itself as being in a kind of leadership, a kind of superior position, which is often quite a false position. And then secondly, whether science is able to link across different value positions in the same way. Is science able to produce its own set of knowledges based on methodology that can make values transparent, not ignore them, but at the same time not ignore the scientific methodology? I guess there's I'm sure Joe and colleagues have thought about this long and hard, but there's always a challenge to the decolonization of science. If that's about trying to take a power hierarchy out, that one would lead to challenges around values as opposed to evidence, which of course are never value free. But that could be that one, how does one balance a rigorous, if still value-laden description of evidence through a scientific methodology against local experiences, which are valuable, probably drive behavior more, but might not be very transparent. And similarly, at the decision-making level in ministries and organizations, that private interest that Nora brought up, the sense that science is never used on its own, it will always be filtered through private interest. And if we pull back on the importance of a transparent methodology in science, do we just open up space for that private interest to expand into? So yeah, I'll leave it there with those reflections, but thanks very much for the presentations.
I want to bring in Professor Leno, who is a professor in public health, medical anthropology in the School of Public Health, University of Witwatersrand, that is in South Africa. And Professor Leno will talk to us about how the evidence has been used to tackle health challenge, particularly COVID-19, and how can the health-related evidence be used to address other challenges. So that's where we try to connect to the other, challenges around disaster risks and climate change, and also just to address what could be the existing gap. So, Prof, you have about 8 minutes to give your address.
I want to just take some lessons very quickly from the particular team that I was leading, which was the social science team. So I'll skip over this. The social science team, which was concerned with vulnerability. And the challenge for us was not so much how evidence had been used to tackle the health challenges, but what if there were no evidence to begin with? And that's what we were worrying away with in terms of vulnerability. And I'm going to walk through that now. So the evidence, policies and programs are developed on the basis of what is already known. And that was really clear to us all as we were working on the program around policy relevant research and feeding research into policy during COVID. The work is conducted within government departments and parastatal bodies, as well as universities and within civil society. And as we're well aware, not only is it informed by colonial relations and a dominance of very particular northern literatures, and certainly that's true for social sciences and humanities, but it is also dominated by local norms and values. So typically what we don't know are people that fall outside of the purview of government for whatever reason. At the same time, what we were very aware of last year and this year is the way in which governments balance their resources with pragmatic decisions in the context of urgency. And that is clearly the case for COVID, but it is also the case and will be the case for climate disasters and emergencies, and increasingly with additional problems associated with global warming, and it will follow on with new emerging pandemics, including quite clearly AMR.
Yeah.
So lessons from the past. One of the things that informed us was our understanding of what vulnerability did, and we were really concerned to tease out the relationship between vulnerability and human rights. And it was clear that relations of power and subordination play out, including under conditions of urgency. And I think that both Joel and Nora brought this out really well. And all crises have these basic conditions, I believe. So this includes the way in which any disease, but I'd also say any crisis or any urgent or disruption in social life, any of these is felt more intensely because in particular sectors of society, because of the way in which it exploits pre-existing vulnerabilities. vulnerabilities amplify the effects of infection, and in the case of a health crisis, or amplify the effects of a disaster. And the disaster amplifies the effects of vulnerability. So there is a correlation between the two. And that is always the case. Sorry, I just flick back on this, but at the same time, states are limited to what they're able to do, which is the importance of ensuring policy relevant information is flowing into states in order to support decision making in the best possible way that does not further marginalize or render vulnerable or render lives precarious for populations. But also prior tensions and divisions are sharpened in crises, and we are very well familiar with that everywhere. So one of the ways in which I've been interested in unpicking this is the way in which the unintended consequences of the initial responses to the pandemic expanded vulnerability and led, this is a photograph from South Africa of food queues. The measures that were undertaken by government were always built upon measures that were already there, so that the lives that were to be saved were lives that were known, that of people who were registered, for example, and people who had access to services, and the livelihoods that became a focus of intention, and particularly from late last year, were the livelihoods of people who were known to be employed in formal employment settings, not so much people who were so marginal as to always be operating under the radar. So somebody without papers, for example, who was regarded as, in quotes, illegal, somebody who was working on the margins of the law or was acting unlawfully, drug selling, for example, would never be included in the range of actions that would be taken to minimize risk for these populations. So the mechanisms of care that were operationalized, and from the work that we did within the ARIN program, this was true across most countries on the continent that acted with speed in response to COVID. The action was firstly to draw on the mechanisms already used. So the evidence was not new evidence. It was evidence that was entrenched in policies and programs. People were concerned, and very early on, about changes in wages and loss of employment. And in many cases, and that did include Kenya, it did include, I think, to an extent, Uganda, Nigeria, certainly South Africa. So social grant systems were topped up. New grant systems were introduced. Very early on, people became aware of markers of social distress, such as those that impacted upon women and to a lesser extent on children. But again, a large portion of the population fell outside of this. So the report itself emphasized, our section, emphasized human rights and interdisciplinary perspectives. And I think that this really echoes with maybe a more tangible and pragmatic bent rather than sophistication of Joel's comments, but it is the same issue around the need to understand what populations are engaged with and what kinds of perspectives are required and what kind of methodological tools might be needed to reflect upon risks and vulnerability, precariousness, and social exclusion. So we concluded that COVID acknowledges long-standing inequalities, that population responses are required to address these root causes of vulnerability, but also, of course, what happens under a crisis is that it's too late to address the root causes anyway. And And so there is, I think, an insistence that needs to come from the science community across all the sciences to go back to these root causes rather than to always be scrambling towards the end of a crisis when we realise who has been left out and who is not being responded to. So just in summary here, the social effects of infection and lockdown, and here I'd also want to say the social effects of any disaster is felt hardest by people who are vulnerable or dependent. And those vulnerabilities and dependencies includes people at either end of the life cycle, not people who are of working age, but the people who rely on them. It includes people who have non-normative, if you like, capabilities, and that includes people living with a range of disabilities, people who are already isolated, people in congregate settings, and I don't only mean jails, but I think that for the most part, out of discomfort, many of us avoid the attention that maybe we should be placing on orphanages, age residencies got a good run with COVID because of the differential mortality, but refuges, congregate settings that have been forced through homelessness of overcrowding people in informal settings, living under bridges and in sewers. People who lack papers, such as many people who are informal, I guess, refugees, but other people who are entirely outside of who we would regard as citizens or are excluded or actively discriminated against. And in this group, I think we have to include sexual minorities, sex workers, people who use drugs, and as uncomfortable as it might be, we also have to include people who rely on selling drugs for their work, but garbage pickers, recyclers, other kinds of people who are part of the fabric of social life, even when it is contradictory to the social norms of any government or our own value systems. So what I'm going to conclude with is the need to learn from past mistakes and successes, to reinforce the point that strict lockdown saved lives, but it didn't necessarily protect the people whose lives were seen to be on the border or out of anyone's ambit. Lockdowns was a blunt tool causing major side effects downstream, and we are now facing long-lasting implications as a result of that, although I don't believe that there was a necessary choice in that. What I do think is that we do need multiple criteria for pandemics and policy making and need to be able to act in that regard. So my apologies if I've gone over time, and I didn't have you can now see that I'm actually here. That was not a recorded voice.
All right, thanks so much, Prof. Very insightful and yeah, very strategic again. Right, so I'm a senior advisor about disaster risk resilience at the American Red Cross, where he leads the organization in developing the knowledge base for better understanding and operating effectively in the urban context. So very much linked to disaster risk discussion. And the question she's going to tackle is how has evidence been used to tackle disaster risk challenge in Africa, and how is the DRR related evidence used to address the challenges of climate change and health risks? You know, what are the existing gaps? Basically taking it from the lens of DRR. So, Anuru, you have about 7 minutes.
Up and start. First of all, apologies for not able to join the whole session because we have our own urban resilience conference going on, and I will put the link in the chat. and invite you all join. It started yesterday, but it's 3-day conference, and we discuss many aspects, including COVID and climate change in urban. With that, so I was actually going to start my presentation talking about vulnerabilities, because I think that when we talk about evidence-based, evidence to make sense, I think really requires understanding the vulnerabilities at a granular level. But I will skip that part since Professor Leonard had already laid it out really well, so saved me time. So I will skip that part. But let's look at what is happening in the disaster scale. And it is, can you hear me? There is some echo going on, I guess.
Maybe Salome, you mute Joseph.
Okay. All right, great. So when we look at what's happening in disasterscape, I think it's obvious that the weather-related or climate change-related disasters are growing. And it is related to climate change, related to urbanization, many other causes, but this is evident. So while this is really scary in a way, but it has some aspects that is relevant to our conversation today, which is that there is an element of predictability in weather-related, climate-related disasters. And that's what I will talk a little bit about today. Let me just go to the next slide. And this is, as you can see, weather-related, climate-related disasters are prevalent in Africa. Just in the last 30, 40 years, around 740,000 lives lost, and the cost of it is close to $40 billion. And mainly you see the drought, extreme temperatures, flood, and storms. So this is very relevant to Africa, as well as other continents, of course. But when we talk about vulnerabilities, again, Professor Leonard really laid it out. The vulnerabilities has many hidden elements, and some of them are not always obvious to us as a humanitarian organization. COVID-19 showed it to us very well, actually. So we really need to get better at understanding the specific vulnerabilities, especially in an urban setting. And this has many aspects, personal aspects, community aspects, and also systemic aspects, understanding the systemic vulnerabilities, systemic failures that contributes to vulnerabilities to disasters and climate change as well. So I will, since I have only 7 minutes, I'm just going to jump to what does it mean? What we learned as Red Cross, Red Crescent movement from the ground, what we learned, what works for effective disaster and climate, addressing disaster and climate risks. So first thing is participation, accountability, and accessibility at all levels, not just the disaster management continuum, but I'm also talking about at all levels of the society, individual, household, community, all the way to local governments and national policies, which you already talked, academia, science, everything. But there has to be a much stronger participation, accountability, and accessibility elements to it. So we also see that while we see, sorry, I just want to go back actually. This one, yeah. So the prioritizing most vulnerable people and places and measures, we can measure our success based on lives. But we also know that we see that while there is a declining trend in terms of loss of lives, we also see there's a reverse trend, economic losses, which is also very important because people are losing their assets, people are losing their livelihoods, and we are seeing it more and more. So that aspect is also important, and we have to understand that how people protect, how they can protect, and how we can reduce the economic losses as well. And the other aspect is, of course, improving risk awareness, information and communication. That is especially, we are living in an age of such a great connectivity and digital tools and everything, but we still see that awareness about risks is not as at the level as we wish. And also information and communication, we have great challenges there, especially like you will all remember or still happening in COVID, we had to deal with misinformation. We had to deal with people refusing to even listen to each other. So we see that quite a lot now, and our efforts are now establishing networks and really trusted networks for disseminating the correct information, timely information. But information also has to be inclusive, and people has to have equal access to the information, and communication also has to work two ways. It's not just certain organizations are disseminating information or warning sign, but we have to get better at listening as well. That's a big lesson we learned during the pandemic. And I guess we already talked about, previous panelists also talked about the systemic failures and underlying conditions of risk to reduce long-term vulnerability and exposure. That is at the heart of the, not just response recovery, it's at the heart of the disaster risk reduction and adaptation to climate risk. That's something also humanitarian organization, forcing humanitarian organization and development organizations to come together and work together. I see that it's happening a little bit, but clearly not at the level that that we wish. But there shouldn't be any distinctive, such a distinctive disparities and silos between development agencies and humanitarian agencies. We both should aim at improving the lives and for the sustainability and the long-term recovery. And related to that, of course, protecting nature, nature-based solutions. I'm sure you are all hearing this a lot. This is something we also learned. And a lot of times we find ourselves working against nature, but this is quite changing. And we are, as a humanitarian response network, we are really putting our efforts to understanding our impact of our actions on nature and environment, but also putting a priority to protecting and integrating protecting nature into all of our operations. With that, I want to go back to the anticipation. As I mentioned, the climate-related, weather-related, meteorological-related disasters are increasing. That is, and it is predicted to be increase more. Extreme heat, floods, wildfires, you name it. But that has this anticipation and predictability in it. So that's why we are now working on increasing different mechanism, financial mechanism, this different response mechanism for strengthening anticipation. And I will put some links in the chat later. We have an anticipation hub where you will find more information about everything I talk about anticipation there. But I will just show one example here. So this is, as I mentioned, droughts are a big hazard in Africa, especially. So when you look at the timelines of a typical drought event, so the question is, where do you take your actions? And typically, traditionally, even though a lot of times we have that, it is predicted. We kind of know that it is possible to a certain degree of course, predictability. We know that there could be a drought, but most of the times we wait until it hits people, and people start sometimes migrating, and sometimes, and then we we start asking for humanitarian aid, but it's too late. It's too late. It's also a shame that while we know that's happening, might happen, we waited so long. So we kind of changed our system and developed this forecast-based financing and action system, which is right now implemented in quite a lot of countries. I can't give you the exact number, but you can find it in the Anticipation Hub link that I will put. So what we do is, instead of acting after the event, we set up the systems and with all the stakeholders, meteorological institutions, communities, all the relevant or government organizations, also financial institutions, credit card companies, for example, set up the system and identify the triggers for a certain hazard, whether it's extreme heat, whether it's flood. These triggers and thresholds are based on scientific research done locally. So once you identify those, you set up the system and connect it to early warning system, and then you know that you know the triggers, like when do you send the message, what kind of message you send to communities or other organizations, and you also raise funds. We collect funds in a pool ahead of time. So instead of people get hit, and then a lot of times they don't even have the money to move. They might know that flood is coming, but sometimes they cannot move because they don't have any money. But then we try to reach them after the event. So instead of that, we have this system, trigger system, we distribute funds and start the actions before the event happens. And that model has been implemented in several countries, most recently in Bangladesh, and proved to save not just lives, but reduce the damage to assets, damage to livelihoods as well. So that is what I wanted to bring into this super interesting conversation about this, really based on, again, scientific research and evidence, but acting earlier because we have this information. With that, I'll finish my presentation. Happy to answer any questions. Thank you.
I think one of the things that I've seen being raised or being asked is, what constitutes evidence? How do you define evidence? And that has not come out clearly. It would be good to hear reflections from one or two members of the panel. So, Leno, do you want to try and ventilate that? What does evidence constitute? And then I will give also one of the ARIN fellows who made the highlights to basically also highlight what the evidence means.
I think that many of the presentations have really opened up the question of what is evidence. So I do think that, you know, your question is timely, though you've caught me kind of off foot in because you know, conventional evidence is always evidence that has been filtered and screened, even if the filtering and the screening is what goes into a scholarly journal. And I think that really from Joel onwards, but also reflected in Nora's presentation, and then, you know, most recently by both me and Anur, the question is, how do we constitute evidence with populations who are not contributing to an evidence base either through their work or because they've been counted in the first place? And I guess that we're always capturing evidence, including in informal ways, and the unsettling of what knowledge is, of what reliable evidence is, and of how that can be used to inform policy really needs to be rethought. So, I mean, if I'd like to actually follow up from Anna's point around timely action and anticipating. And of course, if you're doing any kind of future modeling, you know, you're working with some educated guesses so that that can be easily dismissed, and we're watching the cost of that, and we're working against ticking timelines in that respect right now for both antimicrobial resistance and for the costs of climate change. But if we rely on a particular canon of what constitutes knowledge, then there will never be evidence, and we will always be back on the back foot.
Thank you. I think that's a question we need to ventilate better, what evidence means. So thanks. And maybe some additional thoughts as we close from Aina, then Nora. You mentioned quite a lot on evidence. Aina, what are your thoughts? What does evidence constitute in this case?
Thanks for that. I think when we talk about evidence, one thing I realized that there seems to be a lot of case studies, reports, but all of them, unfortunately, looks at the evidence from a project point of view, which is really honestly disappointing. We need to, I don't know how to get out of this, to be honest, but I wish there could be evidence looking at and capturing what actually worked from a much wider perspective. Whereas we see that every organization is just trying to prove that they did right. Which is understandable, and we do the same, to be honest. Like, we're not kind of out of this, but this is not working really. I mean, when we go to the communities and show them the reports, they don't really relate to it. It's not like their lives. It's that I have personally seen that. It's not what happened to them is not really reflected, but what is reflected is an organization's project and this and that, which is really sad. So I wish we could find a way, unfortunately, and I could propose a very practical way. I don't, but hopefully I'm hoping that with citizen participation, citizen science, people having more voice, eventually we will get there and people actually tell their own stories rather than us giving a very different picture. Thanks.
Yeah, expert interpretations of evidence. We need to question that, and I like your point around consensus and keeping that space for people to tell their own story. That's very powerful, because that is really the evidence From my side, I think these are really discussion. There's a lot. There's just a lot, and I really hope that at one point we can find a cadre of people or a cadre of talent researchers who are linking these kind of things and are able to define some of these questions much more clearly in terms of what is evidence, where do we get it, how do we make it much more effective, and how do we use it to solve multiple problems with multiple beneficial outcomes to the society. Professor Felix, it's your turn to close the session. Thank you very much.
Thank you so much, Dr. Atela, and I again recognize the keynote speakers for the wonderful presentations, very thought-provoking, that have come to our attention. And it is indeed my prayer that as we move forward, these will be investigated even further. There are a lot of times when we take certain things for granted simply because we define them differently. So I think as a cadre of researchers, we ought to have very clear definition of things and then move forward. So may I now take this opportunity to thank all of us for attending this meeting, and we will continue our meeting tomorrow. Have a good evening or good afternoon, good morning, depending on where you are. Thank you. Okay, bye-bye for now.
Bye-bye. Thank you.